It's time for The Story Behind the Person, featuring lively, in-depth conversation with compelling guests from our community. And here is our host, Jonathan Van Bilsen.
Hello and welcome to this episode. My guest today is Dr. Matthew Schurter, a physician taking up the task of dealing with an opioid crisis in Durham and beyond. We'll learn all about issues facing people with this terrible addiction, and what a community should and could do to help alleviate it. We'll also get a glimpse into the life of Dr. Schurter, his accomplishments, and his involvement in the community. We'll be right back after these messages.
Top care with top stylists. Book your next hair appointment with Port Perry's award-winning hair salon, Rosario Greco Styles. The hair experience you deserve. Book today. Call 905-985-0099.
Welcome back. As I mentioned, my guest today is Dr. Matt Schurter. Dr. Schurter, welcome to the show.
Thank you very much for having me.
So we're going to talk about your latest venture, which is into the opioid crisis. Just before we do that, just a little bit of background on you. So you started in a small little town called Listowel.
That's right.
And so you've always been a small town guy, I guess.
Yeah, except for during my training, I suppose, where I lived in Kingston and Ottawa and Sudbury. But yes, I grew up in a small town.
And you said Sudbury as well?
Mm-hmm.
That's pretty exciting.
Actually, it was a pleasant surprise to live in Sudbury for a year.
Is that right?
I must admit. Yes.
And why did you go up there?
That was my family practice anesthesia residency year in the Sudbury area. Yes.
It's come a long way since.
Exactly.
I remember Sudbury in the 1960s. It's come a long way since then. So now you're with Medical Associates of Port Perry. You also do travel medicine, right?
Correct.
And are you a traveler by nature? Or
I'm a traveler. I'm interested in the world and in travel, and just through the course of my training, learned more about infectious disease and some tropical medicine courses. Took an interest in advising people on pre-departure travel advice. So yes,
right.
Yes.
That I'm sure that's an area that's changed in the last 7 or 8 years, especially with the pandemic being what it is. But there's much more happening in the world, if you like, for lack of a better word. And I'm sure there's more medicines to combat things as well. Correct?
Yeah, there's always development, new vaccines or new diseases too. Like if we think back, even the Zika virus in the last decade is a new virus or new on our radar anyhow. So there's always things to learn in medicine, which keeps it interesting.
Right. The one that always interests me is malaria. I've taken, from the days taking quinine and so forth, the number of people that actually die from malaria around the world is astonishing, because we live in a bubble here, right? We don't have that sort of thing, so.
Correct.
That's what I mean. So let's talk about the opioid crisis, which has certainly made the news in the last few years, if not longer. I be very honest with you, I don't know a whole lot about it, and I'm not sure if our viewers do either. So we'll just get into a little bit of the background. So I always associate addiction with street people and young people, and that's certainly not the case, right?
Right.
So who would be affected by the opioid addiction?
Well, for addiction specifically, that can affect people from any walk of life. You may be surprised that sometimes it's professionals later in their career who are getting addicted to opioids. Also, of course, young people. There's a significant number of people who work in the construction industry, actually, who are also overdosing on opioids.
Is that because it starts out as a prescription for pain suffered through their job, or?
That's how many people become addicted to opioids, or at least over the last few decades has been how many people get addicted. I think the world of medicine has learned in the last few decades that high doses of opioids for chronic non-malignant pain, there's a lot of unintended consequences there, and one of them is addiction. But there are different routes to opioid addiction. Some is through experimentation, some is through escape, mental health issues, and some is through feeling invincible, I guess, in a sense, or getting tolerant or getting accustomed to a certain dose of opioids, and then having the ground shift from under you when you get a so-called bad batch, or you get a much higher strength or a different medicine than you were expecting, and the overdose can occur after that as well.
So the word opioid itself, what exactly does that refer to? Because I think of opium when I think of opioid. Is there a relation there?
Yes, that's the origin of the word. Okay. But now when we talk about opioids, we talk about any medicine or drug that acts on opioid receptors. Okay. So things like morphine, hydromorphone, fentanyl, carfentanil. Okay. Medicines such as these. Yeah.
Did you say carfentanil?
Yeah, so that's another medicine or drug found on the street, very potent, like fentanyl is, and we're seeing overdoses from that as
Interesting. Well. Fentanyl is the buzzword of late, because that's the one that seems to show a significant number of deaths in users. But it's also used medically, correct?
That's right.
So if I'm having if I get a prescription for a Percocet or something like that, there could very well be fentanyl in there, right?
If you get a prescription for Percocet,
I just use Percocet as an example.
That's an opioid as well. It has oxycodone in it, but that's a different kind of opioid taken orally. Okay. Fentanyl is usually administered either by injection. For example, we would use it. I do anesthesia as well, as you know. So if you're having a procedure, a painful acute procedure, then we would often use fentanyl or medicines like it to provide some of the anesthetic or maybe the immediate post-operative pain. And we use it because it's short-acting, it's potent, and it can be quite effective for acute pain. Okay. But of course, when we use a potent medication in the operating room with anesthesiologists, nurses, resuscitation equipment, and proper training, that's a much different situation than using that powerful drug outside of that setting.
Right. So what is fentanyl made of? Like what? And you don't have to give me the exact ingredients, but what is it?
It's an opioid, so it is the fentanyl molecule is the drug itself. And
is it grown? Is it manufactured in a lab?
It's manufactured. Okay. Yeah, most opioids now are manufactured synthetically.
So obviously the ones that are administered through a physician in a hospital is not the issue. It's the aftermath of people getting their hands on it when they shouldn't, or just, I guess in some cases, people not paying attention when they're giving it to a patient and giving too much, right?
Too much, and there's a small percentage of people that will start off using an opioid correctly, like using it for an acute pain or after surgery, for example, and then at some point slide into a use that's maybe not for pain and for a different purpose. So that's, for a small percentage of people, that's how some people become addicted as well.
But how would they, and I'm talking about the average person. I'm not a street smart person. I can't go out there and buy anything I want on the street. I wouldn't know how to begin. But so I go in for some pain relief. You give me a prescription for something, which I'm assuming you're not going to give me 6,000 tablets. You're going to give me like 5 or 6, whatever tablets. I finish those. They do the job. How do I get more? Do I go to a different physician? Do I buy it off the streets, or is that a problem? Is that what happens? Do people get it?
Yes, I think you've got it there. For some people, the majority of people will get through their acute pain problem and not become addicted and not overdose. For a smaller percentage of people, their pain may continue, in which case that's a challenge for patients and physicians alike. So, previously, a lot of patients would get on medicines like oxycodone and become dependent or even addicted to those. And then as medicine has evolved and our knowledge of these medicines has evolved, a lot of patients were abruptly cut off from those medications, and then may have turned to the street and then got into some difficulty with fentanyl or other contaminants in the toxic drug supply that we're finding on the street.
I assume it's like any addiction. You can't just quit cold turkey. You have to be weaned off it slowly, right?
Exactly.
And it's got to be a long process.
Exactly.
I'm sure, because
exactly correct.
I keep hearing
the physical symptoms of abruptly withdrawing from opioids can be quite intense, and that's something that once someone becomes dependent on opioids, can be all-consuming. That's part of addiction, is where you ignore other facets of your life at any cost, essentially.
Yeah. Like if it's a seize the moment, it feels good, I'm going to do it.
And then later on, it just becomes, I want to avoid a withdrawal. I think that it feels good goes by the wayside quite quickly, and then it becomes just, I want to avoid my withdrawal symptoms. Yeah.
And I guess you could apply that to almost anything that you do. Like I know I'm not supposed to eat too many cookies because it's going to make me, heavier than I want to be, but at the time when I'm hungry and they're sitting there, I have no willpower, right? So it's the same sort of concept, I guess, except much more deadly, obviously.
Much more deadly, and I think much more intense for most people as well.
Yeah. So how big a problem is this?
This is a huge problem, and unfortunately it's just growing. We had talked about some numbers ahead of time. Something like every couple of hours in Canada, somebody overdosing and dying from opioids.
I read that between 2016 and 2018, one every 2 hours.
So since the pandemic, we've seen a doubling of that. We're seeing somebody dying almost every hour in Canada from opioid overdose.
I don't believe that. I mean, I believe it, but it's shocking. It's totally shocking. It's, again, and pardon my ignorance, but I think a lot of people would just say, hey, this doesn't affect me. I don't want to know about it.
I think you're right. I think a lot of people feel like they're aware of this as a potential problem, but view it as something outside their sphere, like not something that they really need to worry about. Yeah. And unfortunately, that's not the case. A lot of people overdosing and dying are young people, experimental users, and aren't necessarily addicted to opioids. Right. In fact, being opioid naive, like not having used opioids before, and then taking a potent opioid increases the risk of overdose in that setting. So it is something that we're seeing, unfortunately, an escalating number of tragedies, people overdosing on opioids, and it is affecting people from all different walks of life. Nobody's immune to this epidemic, unfortunately.
I was intrigued with, we were talking before we went on the air about a very young patient that you have who had an overdose, didn't die from it, fortunately. But can it happen because of neglect, where people just leave stuff laying around the house, like legitimate prescriptions that are just sort of laying around that
That's how we think some people, maybe it's a gateway into opioid dependency or opioid overdose, where there's easy access to opioids. So if somebody in the family, for example, had a prescription that was given for a legitimate reason, but then that medicine was kept around and not returned to the pharmacy, and somebody became tempted by that in the household, that could lead to addiction or overdose potentially. So that's why kind of taking opioids seriously, or the risk seriously, and managing opioids, returning them to the pharmacy if they're no longer needed, for example, is
any
important.
Prescription for that matter, right?
No, fair enough.
Prescription. Yeah, I mean that's kind of a rule of thumb that you should do that. But I'm sure a lot of it gets flushed down the toilet too, just because of ease, sort of thing, and or gets put in the back burner somewhere in the back of the cabinet and so forth. I was kind of intrigued by a number that I had heard about the indigenous community being a much, much higher risk of opioid addiction than non-indigenous.
I think there is an increase or a disproportionately high number of indigenous people who are overdosing on opioids. And I can't speak with certainty to the cause of that, but it likely has to do with all the things we're becoming more aware of as a society, of the problems created in indigenous communities, disrupting the social cohesion within those communities, and as a result, they're more vulnerable.
Yeah, I'm not looking for the reason for it either. But I just want to talk about how to avoid these things, or how to help people. So I'm going to stop you for 1 second, because we're going to take a break. When we come back, I'd like to get into what people can do as a community to help avoid this problem. So we'll be back right after these messages.
It's about your brand, and at PP Print, we can help create promotional products and apparel that will put you above your competition. PP Print, more than just print.
At Voss, your independent grocer, it's all about hometown living and shopping. Owned and operated by Port Perry's own Terry and Christine Voss, the independent grocer carries many local items to support our town and its residents.
Welcome back. My guest today is Dr. Matt Schurter. Dr. Schurter, welcome back.
Thank you, Sean.
So we talked a lot about opioids and the opioid crisis and sort of what it is. I'd like to get into a little bit about how we can, I won't say eradicate, because we're not going to do that overnight, but how we can alleviate, because it's getting worse, right, instead of better.
Correct.
So do you know if there's a percentage between the opioid addiction that is as a result of prescription drugs that are mishandled as compared to the stuff coming off the streets?
I don't have that on my fingertips, but the two are intertwined, right? Because even if somebody's addiction started through prescription medicines, often then if that supply dries up, then they may have to turn to the street to manage their addiction. So that's one. The treatment aspect of addiction is one important pillar, along with prevention and harm reduction and enforcement. Right. But treatment might be like opioid substitution. Somebody be given a prescription opioid that is much safer and less harmful, and can relieve the cravings for seeking out opioids. Right. And then the other treatment aspects can take effect. Somebody can then work with counselors and work on the other aspects of their life while their craving for opioids is taken care of through medication.
So would you as a physician and your colleagues use something that's let's say a bad opioid as a very, very last resort? Is that sort of how it works, or are there certain drugs that you would have to use for certain illnesses?
That's something actually that's a little bit controversial, because some physicians would think that using any safe supply of prescription opioids is better than going to the street. And there's truth to that, but there's certainly unintended consequences to that approach as well, that we've already kind of addressed. And then there are a couple other specific opioids, namely methadone and Suboxone, which can be used instead of other opioids, with the thought that will help with the cravings, that'll help bridge somebody or take care of the physical aspect of cravings while the other aspects of the addiction are worked on.
Right. And I assume that a lot of people will turn to addiction of some sort or other if they have a traumatic event in their life. Somebody passes away or something happens or whatever the case. So really, if there was help for those people and if they knew where to go for help, they might avoid that left turn into the dark sort of thing.
Yeah, I think there's truth to that. Yeah. Some people self-medicate, and when it comes to opioids, that can be very dangerous. As we talked about, I think offline, with some other substances, maybe the risks aren't quite as high or quite as acute, but with opioids, even a one-time misuse can lead to death. So
yeah, there's no turning back. And also, I was intrigued when I read that if you do X number of whatevers of a drug on an ongoing basis, you build up somewhat of an immunity. But then if you're off it through rehab or something for a month or two, should you go back to that same amount, it'll do you in, correct? Or it could.
That's right. The tolerance that one develops after taking opioids for a period of time dissipates rather quickly, can dissipate within days or weeks. So if one assumes that they can return to their previous dosages, they may overdose on that dose that was previously for them a safe dose. Right.
I'm still stunned with the number of people that overdose. I had no idea. So what is harm reduction? I mean, I understand what the words mean, but what exactly does that pertain to?
For sure. When it comes to drugs or opioids specifically, that has to do with promoting styles of use that are less risky. So not using drugs alone, not using drugs from the street, not combining drugs, and maybe if you're at a gathering where opioids may be used, to have things like naloxone kits and that can reverse overdose, for example, and to have some better understanding within the broader community. For example, what to do in the case of an opioid overdose. To call 911, to know even if you have been using yourself, that you'll be protected by the Good Samaritan Act for reaching out and saving somebody in that event.
That to me is something I think is extremely important, because I wouldn't know what to do if somebody just had an overdose. I wouldn't know what to do. I had no idea. There's no manual. I can't go on YouTube and find something while they're having their thing. So I think the education is very, very important. I'm assuming that is taking place to some degree, correct?
It's taking place to some degree. There's some information on the Durham Public Health website. Durham Regional Task Force on Opioids has put some videos together. We have some videos here too at letstalkaboutopioids.ca, so very short videos introducing the topics that we just discussed. How do you recognize an overdose, and what to do about it? And so they're very they're very short. They just introduce the topic. It's introducing the topic for conversation and further discussion. Because it's something I think we all need to know a little bit more about.
A lot more about. Yeah, absolutely, without question. So, and also, you don't want to do drugs alone, right? Like, you never want to get in that. And not, it's hard to phrase this because you shouldn't be doing them at all. But if you're going to do it, you shouldn't do it alone.
Well, that's a harm reduction concept. Yes, ideally we won't be using drugs at all.
Right.
But if you're using drugs, using them, not using them alone is safer than using them alone. Because of course, if you overdose alone, nobody can call for help or give you naloxone. The risk of dying in that situation is much higher. Of course, if somebody dies, then there's no opportunity for treatment or rehabilitation.
Right. Do you have any idea of a percentage of people who overdose of people who take the drugs? Like, is it 5% of people who use drugs overdose, or 50%, or is it inevitable if you're going to take drugs, eventually you will overdose? Like, is there?
It's not inevitable. I don't have that on my fingertips, but I would estimate it was the lower number you suggested. There's a lot more people using opioids in a safe manner, or using them in a safe enough manner, I suppose. So the fact that we're seeing so many overdoses suggests, we're just seeing the tip of the iceberg.
Right.
There's a lot more people using in the community than those who are overdosing.
Is this a global issue?
This is definitely a North American issue.
Yeah.
I don't know data from overseas, but certainly, it's not just a Scugog or Durham issue.
Right.
This is a Canada-wide issue, and in fact, some communities are faring even worse than ours is. But
Vancouver would
Vancouver,
one of them, right?
namely. But if we look at other places like Sudbury, for example, we brought up Sudbury earlier. But if we can look at the graphs from public health, basically they're indistinguishable if we compare Durham to Ontario.
Right.
Like, this is a problem that's not just for our community or just for a urban or rural community or certain demographics. Like, this is a problem for all of us.
And is it expensive to do drugs? Like fentanyl, that sort of thing?
Well, often if you buy cocaine on the street, you're actually getting fentanyl. I've seen that in my own practice, where we'll check patients' urine, and somebody who thinks they're only doing cocaine, but is in fact doing fentanyl as well, because that's mixed in with the cocaine. So sometimes people are taking opioids without even actually realizing it, and that's extremely dangerous.
Yeah.
And I guess when we're talking about costs, we have to look at the other side of the ledger as well. The cost to the healthcare system, kind of criminal justice system, and lost productivity is huge.
Yeah. Not to mention family life, deterioration, that sort of thing.
Exactly. Yeah. And I guess when somebody has that craving and that addiction, then those other things go by the wayside, and the cost, any cost will be paid if possible.
Yeah. We've all seen the movies. Unfortunately, the movies always have a happy ending, but life doesn't seem to have that all the time. So it begs to ask, okay, so if fentanyl kills people, why do drug dealers sell it? Because they're sort of killing their consumer base, their supply.
Yeah, they're not trying to. What they're trying to do is keep an effect, dilute out the drugs or cut them with other things, and keep an effect for the end user, so the end user keeps returning to purchase them. They're not intending to necessarily to cause people to overdose, I don't think, but what they're doing is creating some uncertainty in that drug supply, and creating a toxicity. So some batches will contain an extremely high amount of fentanyl, where others maybe not so much, because it's not created in a controlled, safe way. Then the end user, and even the person selling it to them,
hit or miss.
may have no clue what's in that, or it often doesn't.
So what I'm kind of getting is then if someone does cocaine on a somewhat regular basis, they would come back because of the feeling they get from cocaine. But if there's fentanyl in it, they have much more of a craving to come back. And because I really like this stuff, I'm going to come back to that person. Is that kind of the way it's working?
I think that's likely how it goes in many situations.
So what exactly is Planet Youth? Something that started in Iceland, is that?
Yeah, thanks for bringing that up. So that's Planet Youth approach. It started in Iceland, and it was born out of a problem in Iceland where the youth, and they were looking at 14 and 15-year-olds compared to their peers in Europe, were amongst the worst in terms of percentage of users of regular alcohol users, smokers, and users of marijuana. And after 2 decades of using this approach, Iceland became among the best or the lowest users of those substances. So, and what the approach is not really prescriptive, but it uses a data to inform an approach. Right. So essentially, you collect data on a regular basis from youth in your region, and you look at how youth are spending their time in structured activities, unstructured activities, what the attitudes are towards drugs, and who is using drugs and which ones. And then you try to, using the data analysis, to tease out, okay, which of these factors seems to be associated with youth that are using more substances, and which factors seem to be protective.
Right.
And the short summary of the approach is that you try to mitigate against the risk factors that increase use and promote the protective factors that lower use.
Okay.
Over a generation, that's been shown to be quite effective, at least in Iceland. And actually, that's been exported to a few other areas. Even New Brunswick's running 4 pilot projects, and Lanark County in Ontario has started a pilot as well. So that's something that's being taken up in some communities in our country.
It sounds like there's a positive reinforcement in combating this. And I know it's a long battle, and it's going to probably get worse before it gets better. But my understanding is from what you've said is awareness and look for treatment, but more important as a community, if you see something that you think, tell somebody about it. We're going to put the information on the screen where people can contact your agencies and so forth. And hopefully this will be a small step in getting it going. Thank you very much for being on the show.
Thank you so much. And thanks for helping to raise awareness of this issue.
I very much appreciate it. It's a very, very important topic, something that we should not let slide by the wayside. Thanks for sharing it. And thank you all for watching. Please join us every month right here to find out the story behind the person on Rogers TV.